Now, a special focus on the state of the pandemic in the world, and we're joined by Dr. Isaac Bogoch, infectious disease physician and scientist based out of the University of Toronto. Thank you so much, Doctor, for joining us on the program. And if we can start off by, understanding what the situation is like in Canada currently, is the disease there under control?
Canada is obviously a massive country, and in certain parts of the country, things are going okay. In other parts of the country, there are significant problems. So the two provinces that are having the most significant issues right now are Alberta and Saskatchewan. They had lifted all public health measures to control COVID-19, and what they saw was a very rapid rise in cases. And still, this was even in the context of having access to vaccines. And, if you look at those provinces, roughly about 75% of eligible, not the total population, but the eligible population had received at least the first dose of a vaccine. But even with that, there were still, many, many people who remained unvaccinated. When those public health measures were lifted, cases rose very, very quickly. And now in those places, they're in a crisis mode. Their hospitals are full, their ICUs are full, and they're having to really use surge capacity and really look for outside help to get them through the next few weeks, because they now have reimposed public health measures to help get things under control.
So, Doctor, is this problem that you're seeing similar to what is being seen in the U.S., where some states have more vaccine hesitancy and politics over vaccine, and therefore cases are rising?
Yes, absolutely. And certainly I think it's fair to say that while we're in the vaccine era, and while vaccines are rolling out some places faster than others, the pandemic is not over. And if you act like the pandemic is over, you're in for a big surprise, because we will see cases rise and we will see healthcare systems that get overwhelmed. I think that's true for the vast majority of the world. There may be a few spots on Earth that have vaccinated enough people that they can lift these control measures. But certainly if we look at, for example, the United States, and in particular the southern part of the United States, where vaccine uptake was lower relative to the rest of the country, and where public health measures were lifted, you're seeing, we saw this massive rise in cases, and we saw headlines of hospitals overwhelmed, ICUs full to the brink, an unacceptable number of deaths. And of course, it's not just a metric of do you live or do you die. The other metric, of course, is you can get really sick. Even if you live, you can get very, very sick and require hospitalization. The other important point, too, is that when healthcare systems are overwhelmed, it doesn't just mean that people suffering from COVID-19 are going to get limited care. It means that this has tremendous, significant ripple effects for everybody else in the area that needs healthcare. So that could be someone who might need cancer surgery, heart surgery, eye surgery, hip and knee surgery, or have heart attacks or strokes and need to come to the hospitals to receive healthcare. If your healthcare system is overwhelmed, you have basically lowered the quality of care and access to care for a large community, and that's a huge problem.
All right, Doctor, let's talk about the issue of booster shots, and that's become a controversy. WHO has asked countries very clearly not to give booster doses just yet. There seem to be differing opinions on the need for a booster dose just now.
Yeah, I would agree with that, and I really like the WHO stance. And in fact, the WHO really clarified their stance. They said, listen, there's a small segment of the population that would certainly benefit from a third dose, namely frail elderly individuals or immunocompromised individuals. That's not unreasonable. But, you shouldn't be giving booster doses to everybody in your population, especially since there are billions and billions of people who haven't even received a first dose of a vaccine. I mean, this is absolutely ridiculous. So I think it's fair to say that there is some very good science and very good data emerging that demonstrates that a third dose of a vaccine would really help for some people, not everybody, but some people, and that we should really be focusing our efforts globally to vaccinate countries where they have populations where they just have very limited vaccine rollout. I think the other important point, too, is that, there might be a point where everybody needs a third dose of a vaccine. But that time is definitely not now. I don't think we have any compelling data demonstrating that everybody needs a third dose right now. We should be open-minded to it, that it might be needed in the future, but that's clearly not needed now. if people are giving third doses now, I think there's very reasonable evidence to suggest that that would be immunocompromised individuals or perhaps frail elderly individuals that just don't mount the same degree of an immune response to the 2 doses as the general public would.
Now, Johnson & Johnson has said that a second dose of their vaccine in 2 months means better protection, but they were meant to be a 1-dose vaccine. So what does this mean?
Well, I mean, I think there's a few ways to see it. One is that many of us watching this from the very get-go sort of had a suspicion that the single-dose Johnson & Johnson would be very good, which it is, but it could be better with that second dose. And there was certainly discussions about this, even when Johnson & Johnson was rolling out their data for their first dose vaccine series. Now, with the second dose, it's pretty clear that a dose 2 months later does provide better protection than just the single dose alone. I think that's also pretty reasonable. We also have to appreciate, too, that the virus has changed a bit as well, and we're dealing with a Delta variant, whereas a lot of these vaccines were, well, not all of these vaccines that we're using now were really designed for the initial version of COVID-19 that emerged from Wuhan, and the virus obviously has changed significantly since then. So, that might be driving things a little bit as well. But in general, I think it's fairly reasonable. In Canada, we're not using the Johnson & Johnson vaccine. We've approved it, but we really aren't using it. It's used mostly in the United States and elsewhere in the world. But yeah, I think that data is pretty compelling that a second dose is helpful.
A recent study found that variants are becoming better at being airborne. Now, what does this mean, especially going forward with the new variants emerging?
It's hard to know. I mean, it really is hard to know and hard to predict, what the next variant is. It's pretty reasonable to know where the variants will emerge, and sadly, those will emerge most likely in areas that have low vaccine access. Yet another reason why we should really be focusing our efforts on vaccine equity, global vaccine equity. Obviously, it's the right thing to do. It's the ethical thing to do. But in addition to that, it will help from a global standpoint by reducing the likelihood that variants of concern will emerge. In terms of transmissibility, yeah, Delta variant is very, very transmissible. And I think there's been a lot of work looking into, more virus either being produced or a higher viral shedding or more affinity to receptors. I mean, we could talk about different mechanisms, but the key thing here is we know where it's transmitted, and it's primarily transmitted in indoor settings. How do you create a safer indoor space? Limit the number of people in an indoor space, mask, good ventilation in those settings. I mean, those are the key features. And of course, if you have access to vaccines, vaccination is still fantastic. Of course, it's not perfect, but it's still a fantastic layer of protection.
And the other big issue that everybody's talking about right now is the school experience and opening schools here in India. We're seeing, different regions having a staggered opening of schools. We're getting the vaccine soon for children, but most experts say that we need to move on with the schools opening.
Right. I mean, it's interesting because schools are really one of the few sanctioned mass gathering events on the planet. And it's tough because in many jurisdictions, those are sanctioned mass gathering events with an unvaccinated population in many places. So it's fair to say that, of course, kids can get COVID-19. Of course, kids can transmit COVID-19. And if you don't take steps to control the spread of this in a classroom, you will amplify this virus in your community. And, we've seen this time and time again. You have to take steps to reduce the risk of transmission in the schools. And you can take simple steps to do that, right? You can, for starters, reduce the number of students in the classroom. You can vaccinate or promote vaccination in those who are eligible for vaccination. We know that masking can certainly help. We know that ventilation can certainly help. And ventilation doesn't have to be, sophisticated, expensive equipment. It could also be opening doors and windows as well. So there's a lot that can be done to lower the risk of transmission within a classroom. One of the other things that often gets lost in these discussions is the obvious, is if you keep the virus under control in the community, you will also lower the probability of introducing the virus in the classroom. So, community control efforts are extremely important to help with healthy, safe schools.
And this comes at a time in India where there's a lot of talk of a possible third wave, but there's also an expert view that in India, COVID will become endemic in 6 months' time. What would you say on that?
So I'm completely in agreement with that, with the narrative that this virus is not going away, and at some point, however we define pandemic and endemic, it will transition to an endemic virus. Like, we get it. This virus isn't going away. What gives me a little bit of hesitation is the confidence as to the timeline on that. And I just don't think we can have that confidence that, you know, it's going to be blank number of months away. Listen, we obviously have to do our best to plan, but I think we have to do a better job at communicating uncertainty. You know, some people have been vaccinated. That's fantastic, and that will help. Some people have had the infection and have recovered from that infection. They have some degree of immunity. Like, we can't ignore that. That will help. But we need to vaccinate as many people as possible to really ensure that those subsequent waves are smaller and smaller and smaller and don't have the same degree of disruption on our society as they have. But, you know, putting a timeline on it, I think, is a bit foolish. I mean, it's helpful to model this, but it's just challenging to do because we don't have all the answers. We don't. You know, there are variants that might be emerging. There are limitations in the data that we have, but there are things that are under our control, right? We know how to control this at the community level and at a local level, and we can do things to do that, and we can certainly promote vaccination, especially in under-vaccinated communities. I think we talk about global vaccine equity as being extremely important, which it is, but if you think more locally, you know there are certain communities in any jurisdiction in the world that are under-vaccinated versus others, and they tend to be lower-income communities, and depending on where you are in the world, sometimes racialized communities, and we really need to have significant outreach, good community outreach, working with local community organizations, with community leaders to really promote vaccination in those under-vaccinated communities. And you know, we can't ignore the barriers to vaccination. There are tremendous barriers. There might be language barriers, mobility barriers, financial barriers, etc. And we really have to do everything we can to lower those barriers to vaccination to really ensure that there is equitable uptake of vaccines and equitable access to vaccines in communities that are under-vaccinated.